Oh, good night or good afternoon. Okay. First of all, I would like to thank all of you for coming. At the same time, I would like to thank many people that I'm seeing, head teachers that I'm seeing from different schools. And I would like to share with you our experience as master educators. First of all, my name is Benard and this is my sign name. I am personally a teacher in Nangoma School for the Deaf. You've heard the word ME. You think it means me or what it means? Maybe you've been wondering what it means. ME means master educators. The master educators, we have some who can stand. You can see them. They are around here with us. We have a master educator from Maseno School for the Deaf. This is him, and his name is George Atieno, and this is his sign name. And they are both working in the same school, Senior School for the Deaf. This is his sign name, and the other one is Margaret. So we have one Emmy who is working in Nairobi, and he's centered by Tom. I think Tom is one of the faculty. Yeah, so he's part of us. So thank you, Emmy. As master educators, we work in deaf schools. Not only working with HIV, but we are teachers. Your job does not focus what you do alone. We have other activities that we do. So we are working as teachers, so we just don't write on the blackboard and be with the kids for classroom only. We have other activities. We deal about deaf children's health, and we advocated to get this manual, and this is why we are launching this manual so that we can continue with that activity. Our work as ME involves peer support. The children themselves, we empower them so that the children can empower others, and they are free to teach themselves. We don't even keep observing them. After we teach the peer educators, they can observe others, and then they can learn from each other, and we leave them independent. Because in Kenya, most of the time, if you're working under supervision, it's not enough. We have to try to make deaf people to be self-reliant. So that means when we finish teaching them, then they can go meet other deaf people in the community, share ideas with them, and then they can learn from us that way. About the manual, the idea in the manual is from the deaf people themselves. Most of the manuals used by deaf organizations, they are from here in community. The deaf themselves are not involved. That has been the question. If deaf themselves do not have a manual, how can hearing people understand the deaf community? So if we try to support them that way, they can understand. But if hearing people continue and they leave the deaf people behind, then the deaf people will not understand anything. So this is why we really advocated very, very hard for that. The experience that we had is that we got first-hand information. As a deaf person, I was communicating with another deaf person using the first sign language. If I put an interpreter, that's second-hand, because at the same time, the interpreter can, distort the information. The deaf person was communicating directly to the other deaf people. If there's an interpreter, then we also did not have money to pay for interpreters. Many projects need money, and if we don't have money for that, the deaf people themselves can do the activities and they continue, whether money is there or not, through use of sign language. And also, we had some challenges, and the challenge was, challenges and success are inseparable. You cannot succeed without challenges. To succeed, you must have challenges. You try to do everything possible, but you must face challenges. If you work, even you don't work very well, you also face challenges. So it's the same. You will face challenges anyway. So then, the biggest challenge that we experience is that the most deaf community do not have the fund. They don't have the fund. The hearing community fear that the deaf people cannot do this or that. But if they're given an opportunity, deaf people can do these things. So we are trying to open the way for deaf people to show their capacity and to empower others. And also, the other challenge that many countries, here in the country, many people do not understand sign language. So that means if the deaf people themselves communicating with one another, information is passed very easily. And that happens even within the family, like I explained before. And also the community expectations. Many people expect something big. They see deaf people doing something and they wonder where this coming from. Some people think that, you know, we are getting a lot of donor money to do these things, but that's not true. We only volunteered. Because I'm a teacher, I volunteered to participate with ME. That I have not even graduated personally. That depends on your experience. It's not your degree. Your degree doesn't matter. In Kenya, you can see very many deaf people who have no degree, but they can do very many things. And they can transform the lives of deaf people. Most deaf people and deaf and hearing people given responsibility, they can do the same. Now about HIV and AIDS. HIV and AIDS is continuing, but the problem is growing. So how can we change this? We have to start from the basic and start changing from down here, then we may reach up there. Sometimes ignorance is a problem. You would ask people AIDS is bad and they ask it's bad. I must test to know that it's bad. But by the time you test, it's too late. That's where we try to start with the young ones. As they grow, they have the information. If you start up there, it's very difficult. Because if you start up there, the children are expecting to look at those people up there. So it's a lot of work to focus in schools and focus on the children so that we can inform the deaf children to inform the community to change so that we can continue. I want to thank Sahaya Project and Grace Africa and Cohen, director who has helped us in this program. We've had a lot of challenges, but we've been persevered, and I would like to thank you all for coming here. Thank you.